Some of you in healthcare AI may have faced data problem. Real patient records are locked behind privacy walls, buried in legacy systems, or just too messy to use at scale. And with the modern reality with generative AI, it is so seductive to generate the data you don't have. Can't share real patient records? Generate fake ones. Not enough rare disease cases for your training set? Synthesize them. Worried about GDPR? Just make the data up. Sounds great until it is not so. The reason is simple: model collapse. This is the phenomenon when AI model is trained on outputs of other AI repeatedly over and over again, so it starts to forget the edges of reality. For example, rare but real patient presentation gets smoothed out. Outliers disappear, the distribution narrows. So for generation 1, it looks like trained on real patient. Generation 2, trained on synthetic patient based on generation 1. Generation 5 is trained on what exactly? Progressively blurred photocopy of medicine. The model gets very confident about the middle of the bell curve. Everything outside it starts to look like noise, even when it is a real patient. In healthcare, that noise is often where the actual diagnosis lives. Synthetic data as a supplement, augmenting rare disease data sets, testing pipelines safely, is generally useful. Synthetic data as a replacement for real clinical evidence is how you build a diagnostic tool that world's class at treating patients who don't exist at all. The question to ask anyone designing synthetic data solutions is, at what point in your training pipeline does synthetic data touch real clinical outcomes? And how do you validate the gap doesn't widen over time? Garbage in, garbage out still applies in this case as well. It's just a nicer label now.